Hi, my name is Monica. I'll be your student nurse today. I'm going to do hand hygiene. How are you doing today?
Good.
First, I'm going to start off with doing some vitals, and I'm going to ask you a couple questions. So let me get this blood pressure cuff on you. Can you tell me what your name is?
Alex Wilson,
Can you tell me how old you are?
24.
Good. Can you tell me what date it is?
Today is Thursday, the 29th.
Good. So, that's good. And how have you been feeling lately?
Good.
Would you say your mood is good?
Yeah.
Awesome. So right now I'm just checking your blood pressure. Awesome, I got 112 over 78. That's great. Can you also tell me who the president is right now?
Donald Trump.
Good. So that's good. Now I'm going to get your temperature. I'm gonna have you hold it in place. Got it. Make sure it's on. Okay, just put it in when I tell you to. Can you grab it with your other hand, please? Thank you. Okay. Very good. So now I'm just doing heart rate. Awesome job. Thank you. Heart rate is normal. And I'm just going to just listen to you, just looking at your respiratory rate right now. So just breathe normally. Awesome job. Okay, so respiratory rate around 12, which is in the normal limits. Okay, so now her blood pressure was in normal limits, but if she did have orthostatic, or if she did have a low blood pressure, or she told me that she felt dizzy upon standing, I would talk to her. I would do a test for orthostatic hypotension, and that would include, I would have her lay down for 5 minutes, take her blood pressure, then have her stand up for 2 minutes, and then take her blood pressure then, and that would, and if it's 20, if the systolic is 20 below, and then diastolic is 10, then I would probably refer her out and have her get checked out somewhere else. So now I would go to her head. I would inspect her head, make sure there's no lumps or bumps, ask her if she has a headache or anything. It looks normal to me. I would feel her TMJ. I would tell her to open her mouth. No clicks, no pain or anything, so she seems fine to me. I would percuss on the sinuses, make sure they're hollow in 4 major regions, make sure there's no drains or anything in there. I would check her cranial nerves on her temporal. I would ask her to clench down. Good, very good. They're equal. And I would have her look at me, and I would have her stick her tongue out, and I would have her puff her cheeks out, show me her teeth, smile, and frown. Very good. Okay, so everything was normal with her head. Next, I would move on to her eyes. So first, I would just inspect, look at her conjunctiva, pull down to the bottom pink part of her eye, look at her sclera, the white part, look at her iris. Everything looks good to me. They're both equal. Then I'm going to do 4 different tests on her. So the first test I'm going to do is see if her pupils are direct and consensual. So good, her pupils constrict, which which is good when light comes to it. And when one constricts the other eye, it also constricts, and that's consensual. And I will do another test called confrontation, and I'm going to tell her to tell me when she can see my fingers on the side of at the same time from her periphery. So I'm gonna ask her to tell me when she sees them.
Okay.
She sees them now. That's great. That's good. So we did. We did the right consensual. We did the. Now we're gonna do the Snellen test. So I'm gonna grab this chart right here, and I'm going to. What you want to do is hold it about 20 feet away. So I'm gonna step over here, and I'm gonna hold it 20 feet away, and I want her to read the last line that she can.
PECOLCFTD.
Very good. And then I would have her do up close too. I think it's about 14 inches, and this isn't the right chart for it, but it's a little piece of paper, and I would have her read what she could as best as possible. So now I'm going to do the ophthalmoscope. So I'm going to grab it over here. Okay, so just with the regular light, I'm going to look in her eye, and I'm looking for the optic disc, and that it's yellow, and her has good vascularity. Good. On this side, you want same eye to same eye. Good. I'm going to. Okay. Good. Okay, so now I'm going to move on to ears. So I will just inspect the auricle, make sure nothing is. Sometimes you can have scars or warts back here. There's nothing in there, nothing that I can see directly in her ear. And the other ear I'll check as well. Looks good. I would do 2 hearing tests, and for that I need the. Sorry, I was just grabbing this. I'm going to check 2 tests, the Rene and the Weber. The Rene, I'm going to hit it, and I'm checking for bone conduction versus air conduction. So I'm going to hit it and with my finger, and I'm going to put it up to her mastoid bone, and she's going to tell me when she stops hearing that, and then I'm going to put it in front of her ear, and I'm going to ask her when she stops hearing that, okay? So what we just witnessed was that bone conduction should be not as long as the air conduction. Basically, you hear twice as long with air than bone. So next I'll do the Weber test, and that just tests lateralization, so to see if she hears it one side more than the other. And I'm just going to put it at the top of her head. She hears it basically same side. No difference, which is good. I'm going to look at her nose. I would use a speculum, put it in there, but we don't have one. Make sure there's no nasal polyps, make sure everything is normal. She's not flaring, her nares aren't abnormal or anything out of the ordinary that I see. Nothing coming out, no drainage, no pain. Next I would move on to her mouth. Just inspect her lips. If they're moist or if they're crackly, maybe she's dehydrated, normal color, and then I would have her open her mouth, and I'm just looking for her cheeks, make sure they're pink and moist, her tongue also pink and moist, so like salivary, and then I would also have her stick her tongue out to be able to check the cranial nerve, and then I would also do a gag reflex, which I would use a tongue depressor and put it all the way back to see if we can get a gag reflex. We don't have one of those. And that checks for the cranial nerves. Okay, now I would do the neck and the lymph. And I'm going to have her checking for range of motion in your neck and your lymph. So I'm going to have her go all the way to the left, all the way to the right, forward, good, and then can you kind of go in a circle? Awesome, she has perfect range of motion. And I would check, this is the time where I would check her thyroid, so I would come to the back and check her thyroid, putting my hands on her throat. The bone that you feel, just go a little bit lower, and when she swallows, swallow for me, I can feel the thyroid moving, but it's not like bulging out or it's not enlarged. That would signify some sort of goiter, and she's good with that. I'm gonna do the lymph nodes under her chin. Good. She doesn't have any, and I'll also do her axillaries. I would have her very good. There's none under here. She feels good. So that would be neck, and I would also check the ears. I forgot to check it, but so since she's an adult, I would hold it up and back, and I'm looking for the cone of light. Good, and I see in the right bottom. And tympanic membrane, and also the ear bones. Make sure everything's normal, nothing out of order, or nothing out of the ordinary. Check on this one too. Good, I see your cone of light, everything looks normal. Okay, so that was, okay, so now I'm going to start the carotid bruit just on the neck, just to make sure that she doesn't have any bruit on her carotid. So what I'm going to do is just feel for it first, and I feel her carotid pulse right here, so now I'm just going to listen to it with the bell to make sure there's no bruits. Nope, seems normal to me. I'll go over to this side. Oh, sounds good to me. Now I'm going to start my lung and cardiovascular assessment. So starting with the posterior side, and I'm going to, first I'm going to check for thoracic expansion, and then I'm going to do fremitus. So what I would do is take my hand, put them back here, and have her breathe in and out. Good job, and I see that the lung fields are equal. And I would just also inspect her back and her chest as well, just to make sure that she's breathing normally. She's not, using accessory muscles to breathe because she's out of breath, or she's not breathing too hard or too slow. So now I would check the lung fields, and I think one of the most important parts is making sure you're checking lung lobe to lung lobe and not just down and down. So that's what I'm going to be doing back here. So I'm going to have her breathe in, breathe out, breathe in, good. Breathe in, good. Good job. Good job. And you want to make sure you get to lateral. And I was just listening for wheezing, for anything out of the ordinary, but it sounded equal. So now I'm going to go to the front and listen to her lung sounds on her front. So you want to start up here. Very good. Good job. And then lateral as well. Good. Okay, so lung fields sound normal to me. Now I'm going to do cardiovascular. I'm going to start listening to her I'm going to just listen to her heart on her front, and I'm going to start with the diaphragm, and then I'll move to my bell. So I'm going to start with the aortic, pulmonic, very good, tricuspid, and then mitral. Very good. I was listening for murmurs, if she was having irregular fast heartbeat.
I just pause really quick.
Pause it.
Yeah, like just say, oh, my computer talking.
My computer just blacked out, so I just want to make sure that it's continuing to record. Okay, it is. Sorry. Okay. So I was listening for just irregular heart sounds and murmurs. Now I'm going to start with the bell on the other side to listen for murmurs more closely. So I'm going to start again with the mitral. Good. Tympanic. Tricuspid. Sorry. The pulmonary. Good, and then the aortic. Good, awesome. Okay. So also I would check her pulses. I would check her radial pulse. I already checked it when I was doing the vital signs, but I'll check it again. I would also check her femoral. I would have her lay down and check her femoral pulses right here. Kind of like in the sides of her groin right here. Looks good, and I'd also check her dorsalis pedis pulses. Everything sounds normal. Close out. Good job. Now I'm going to do my abdomen exam. So I'm going to do four quadrants and listen for gurgling, and I want to hear gurgling in all four quadrants. If I don't hear anything in one quadrant, I'll stay there for at least a minute, 30 seconds to a minute, until I hear some gurgling, and move on to the next one. And I listen with my diaphragm and my bell because sometimes you can just hear better with your bell. Sounds good. I've heard vowel sounds in all four quadrants. Good. Good. And if I didn't hear vowel sounds in all four quadrants, I would just stay there a little bit longer. Also, I'm here. I'm going to check for bruit in abdominal aorta, which you don't want to hear. I'm listening with my bell. I don't hear any bruit, so that would be good. And so now, since I have her, still for my abdomen, I'm going to percuss. So I'm going to do percuss in all four quadrants, and I want it to be, I really don't want anything here right now, unless I start getting to the liver, then we can hear some thud sounds. And then, now I would palpate. We want to do that last because we don't want to palpate and then auscultate. So I do light first, just to make sure, see if there's anything superficial, like by the skin, and then I would do deep, so I would use 2 hands for that, and I'd go just a little bit deeper, and I feel nothing out of the ordinary. I would say if she's guarding or rebounding, then I would inquire further. So abdomen is good. Then I would move on to one thing that I did forget actually with the cardio is JVP. So I would have her 30 degrees up, which let's just pretend that she's 30 degrees, and I would have her turn her neck to the side, and I would look at her vein right here, and I would measure it. If it's more than 8 centimeters, then I would send her off for further testing. So now I'm going to go to the musculoskeletal. So while she's laying, I'm going to do a couple of tests. I'm going to check her range of motion and her hips and her knees. So I'm going to take her feet and I'm going to bring it up, out, down, and she didn't seem like she was in any pain or any discomfort. Again, I'll do it this side, in, out, down, good job, no pain or discomfort. And I would also have her do her heel to shin test, good job, and that's just checking to make sure that she can do both. Very good. And I would have her sit up. You. So while she's sitting up to check musculoskeletal, I would start range of motion with shoulders. So I would ask her to go up, down, and then I would do her elbows. So see if she can go in, out, good job, and then her wrists, full range of motion, good. And I'm just going to test to see if she has shoulder strength, and I'm going to tell her push up, good, and then again push down, good. She has great shoulder strength. So then I would do her reflexes. So with a mallet, I'm going to use the thing because I don't have one. And so I would check 3 reflexes. So I'm going to check her knees first. Good, she had a little one right there. And one right here. Good, perfect. And I would check her biceps. Put my hand right over the tendon. And good, I felt just a little bit. Hand, finger right over the tendon, hit my finger. Good, that one was great. Now I'm going to check this one, and I'm going to have her rest completely on my shoulder. Good, she jumped a little bit, which is good. You want just a little bit of movement. It's very slight. Sometimes you can't really tell. Good, just a little bit. Awesome. So we did. Now I'm going to check for strength and coordination. So strength, I'm going to cross my hands so I can remember which one is which, and I'm going to have her grip strength. Awesome. She has great strength in her hands, and I'm going to do some coordination movements. So what I would have her do is go like this and on her laps. Awesome. She has great movement. Another thing I could do is have her touch her nose and then touch my finger while it's moving. Good job. Awesome. Okay. That's awesome. Okay, so next I would have her get off the table, and I want to check her range of motion on her ankles. So I would have her, I know you really can't see it, but I'll explain it, just up and down, good, up and down, and I would have her hold out her leg and extend, good, make sure that works as well. And then while her leg's out, push down, awesome. So that would be range of motion. I would check her spine, so I'd have her turn around and have her bend her as far as she can. I'm checking her spine to make sure there's no curvatures in it and everything looks normal. You can stand back up. I would have her do watch her gait, so I would have her walk heel to toe towards me. Perfect. Very good. I would have you walk on your tiptoes as well. Awesome. And then I would have her hop on one leg just for a couple times, and then the other leg. Very good. Then I would have her do 2 tests Romberg. So first I would have her close her eyes, put her hands out and palms up, and to see if she sways at all. It's okay to sway just a little bit, but nothing too crazy. So it looks like she's not swaying, so she's good. And then I would do, you can open your eyes, and then I would do the pronator drift. So just stand facing me, you don't have to close your eyes, hold palms up, and if she were to pronate in, then that would be some sort of neurological difficulty, and we would have to send her off for testing. So, okay, then I think that's it. Spine, range of motion, Romberg. Okay, I think that's it. All right, thank you.